My name is Sandi Mason. I was raised in Preston, Idaho. I met my husband. We have 4 beautiful kids. We reside in Aurora, Utah. We like to spend a lot of time together. We spend a lot of time together playing cards, watching movies, going to dinner. Life is about family in our home, and we love it. When I was the age of 35, I was tested, and I carry the BRCA gene. I was then sent to different specialists. I was monitored routinely. Every 6 months I had mammograms. I had all sorts of different things that they just kept an eye on me for carrying the BRCA2. When I was at the age of 37, my dad was diagnosed with cancer. We lost him to cancer. We lost my aunt to cancer. And 1 year later, I was diagnosed with breast cancer.
When my mom told us that she had breast cancer, that everything kind of rocked our world. Me and my siblings just felt different because as a 14-year-old girl, you never think that your mom's gonna have cancer. You never think bad things are gonna happen to you, but they do.
Sandi is a young patient of mine. She was diagnosed with breast cancer and was found to have the BRCA mutation. She was a carrier for that mutation. That also puts her at risk for ovarian cancer, which is a very deadly cancer if you develop ovarian cancer. After she was treated for her breast cancer, I took her and removed her ovaries and her tubes and her uterus to prevent her from getting ovarian cancer in the future. I use the robotic platform because I need to be able to see inside and make sure that there isn't anything there that's abnormal. I put fluid inside and I wash it around, and the pathologist will look for cells that are abnormal. The other thing that I do that's really important for the patients that have these mutations is that I remove all of the ovary. So I'm able to get a good margin. I take the tissue around the ovary with the ovary so I don't leave anything behind, because even leaving a little bit of ovarian tissue behind could cause her to have cancer in the future. The robotic platform lets me see this so precise with such magnification that it's a tool that really helps us do better surgery.
I didn't have any reservations. I knew that I was in good hands, and I knew that I trusted Dr. Hun and everything that she was talking about, and I had enough faith in her that I went with it, and I was excited. I had heard other stories about hysterectomies, and Dr. Hun was amazing, and I am cancer-free today.